The Nigerian government, with support from partners, has expanded TB services across public and private health facilities and implemented community-based TB care program to improve access, especially to the rural areas. Number one, there has been an extensive dot expansion. By that, I mean, making sure you have dot clinics providing TB services in all the local governments. Around 2014, we had just slightly over 5,000 dot facilities in the whole country. But as at the end of 2023, we have over 22,000 dot facilities providing TB services. By that, you can access TB when you go to all the major public health centers, primary health care centers rather, you will be able to access TB. So secondly, the capacity of DOTs, general health workers, have been built. In each of those primary health care centers or secondary facilities and even tertiary facilities where we have all the DOTs services being provided, those staff working in those facilities have been trained, to provide quality TB services. Also, TB services, are integrated into the other existing health services provided at those facilities. So when you go to all those primary health care centers or secondary health care centers for other diseases, you are screened. People are screened at the OPDs of all the facilities for TB. And once they are identified to be presumptive TB, that is, they have all the signs and symptoms of TB, they are referred to the DOT facility within those primary. So it's an integration to strengthen the system to provide TB services. Also, the National TB Program has done very well, impressively, to manage, the supply chain management for drugs and lab reagents for TB services. They have ensured that once the drugs come in, they are distributed to the last mile, to the facilities, DOT facilities in all the local governments where people can access it. So it's another way of strengthening the system to make sure that services are brought closer to the people. And of course, they have gone ahead to produce and distribute all the recording and reporting tools that are being used in the TB services. Then at the community level, capacity of community-based organizations have also been built to provide community TB intervention to implement it. Furthermore, we have the crop of community TB workers that are also trained, and they do what we call house-to-house search, active search for TB. So they are trained to visit the households in the community, sensitize people, provide information, help educate people about TB, and they have the nationally approved screening tools to screen people in their households. And if they identify any presumptive people, that is those that have cough more than 2 weeks, all the signs and symptoms of TB, you are losing weight drastically, you are weak, you are having night sweats, all those signs, they have been trained to screen people using those checklists. And if they identify those presumptive TB, they collect sputum, from them, and then transport those sputums to the gene expert sites where they are, processed, tested. And if anybody is found to be positive to TB, those people are also empowered to link those people to the DOTS clinics where they will access TB services. So you can see that community facility linkages have been strengthened, to ensure that people at the rural area have access to quality TB services.